Every visit is an emotional highlight. The pandemic is especially cruel for the elderly. The mortality rate is much higher than among younger people. And many suffer from loneliness.
It's a long time since I've seen him.
The situation is especially grim in nursing homes, where the pandemic highlights deep flaws in the healthcare system. And too often, it's the elderly paying the price. Sending a parent into a nursing home is painful at the best of times. But the pandemic has added an extra level of agony. In Spain, some 20,000 care home residents died of COVID-19. Their relatives want to know, could their deaths have been prevented?
Lola Parra made a point of meeting us in front of the nursing home where her father-in-law died of the coronavirus. In her view, he lost his life because the management underestimated the danger posed by the infection and made mistakes with fatal consequences. The director here told employees not to wear masks to avoid alarming the nursing home residents. When her 86-year-old father-in-law then started coughing and developed a fever, the family asked to have him transferred to a hospital, to no avail. We were told that everything was fine. He wasn't terribly ill, and that's why he wasn't being transferred to a hospital. A few days later, the elderly man died. His case is similar to those seen in dozens of nursing homes across the country. In Spain, the provinces are responsible for healthcare. In Madrid, it's the regional government led by center-right politician Isabel Ayuso, seen here during a moment of silence for victims of COVID-19. Recent documents have now sparked controversy. They reveal that in March, the regional government instructed hospitals not to accept any patients from nursing homes. Nearly 20,000 people in Spain's nursing homes have died of COVID-19. Many of these cases will likely end up in the courts. Hundreds of family members have already sued regional governments and nursing home management. What this is about is the decision that older individuals will not receive medical treatment, knowing that they will die as a result. This has enormous legal implications. Lola Parra has also filed a suit. She finds it shocking that politicians were able to make life and death decisions for other people. I want justice, that those responsible pay for this. Our elderly deserved being treated with dignity. The many fatalities in nursing homes have become a national trauma for Spain.
For more, I'm joined by Adelina Comas Herrera, Assistant Professorial Research Fellow at the Care Policy and Evaluation Centre, Department of Health Policy at the London School of Economics and Political Science. Very good to have you with us. I understand that you conducted a study on mortality associated with COVID-19 outbreaks in care homes. What can you tell about it? How high is the number?
So we found that almost in many countries, about half of the deaths of people who died as a result of COVID had happened in care homes. So although initially a lot of the focus was on hospitals, protecting hospitals and counting how many people were dying in hospitals, we found that there was quite a lot of deaths that were being ignored, not counted. And that was partly because there wasn't much testing happening in care homes. What we have realized is that as many as 3 to 6% of care home residents have died in some countries, and that is, of course, a very high number.
Indeed. And given that we knew from the start that COVID-19 is especially dangerous for the elderly and those with an underlying condition, i.e. for those who are in care homes, why aren't they better protected? Who is failing them?
The initial response was very much focused on ensuring there was enough hospital capacity. So there was a lot of emphasis on making sure that there was space in hospitals. So a lot of people were sent very quickly from hospitals back to care homes, sometimes without testing in some countries. And there wasn't really a lot of thinking, and perhaps this is because we don't have much data in many countries about who lives in care homes, what are their characteristics. And if you don't have data, it may mean that if you're having epidemiological models to try and plan for the pandemic, you may not have the numbers for the population who live in care homes, and they may be completely left out of the planning.
Right, so mistakes were made and people had to die. Now, the report we just saw focused on Spain, but is it the same situation in other countries, or are there significant differences in the response to COVID-19?
We have a very different response in many Asian countries where there have been very few deaths of care home residents. In Hong Kong, in fact, they haven't had a single infection. In Korea, they've managed to control small outbreaks that they had in care homes very quickly, and for Singapore. So we found that in those countries, they seem to have been able to make sure that this didn't happen. But these are also countries that have done generally very well at containing COVID in the community. We have seen that in some European countries and in North America, in the US and Canada, it's really quite a disastrous situation.
Right, and sadly, COVID-19 is still here. What can and what must be done to improve the situation in care homes as fast as possible?
And first of all, we need to make sure that we're very quick at responding to local outbreaks, making sure that if there is a local outbreak near a care home, all the residents and staff are tested regularly while there is a local outbreak. Second of all, we need to make sure that we reinforce and we support infection prevention control in care homes. We haven't had a lot of tradition of these in countries that haven't experienced something like SARS, like they did in Asia. That's probably why they were so much better prepared. But here we now have a chance. We have learned a lot from this first wave of the pandemic, and we have a chance to be much better prepared. And second, I'd like to also say that we have to be much more realistic about whether care homes can implement isolation. So quite often they have tried to apply all these protocols of isolating residents that had potential COVID or confirmed, but they didn't have the means to do it.
All right. Testing and acting faster certainly is the right step to go. Adelina Comas Herrera from the London School of Economics and Political Science, thank you so much for your time. And now it's time to answer your questions about COVID-19. Over to our science correspondent, Derek Williams.
A vaccine for common cold coronaviruses has never been developed. Why are scientists cautiously optimistic that a vaccine for COVID-19 will be found?
It's true that we've never developed vaccines against the various coronaviruses that cause cold-like symptoms, but there's a big difference between them and SARS-CoV-2, and that's that it doesn't just make you miserable for a day or two, it can kill you. In other words, we've never really had this kind of motivation, both medical and economic, to develop a vaccine for common colds. Developing a vaccine is a long, wearisome, and very, very expensive process, but so many researchers and companies are throwing so much time and so many resources into the COVID-19 problem that I, for one, am pretty confident they'll come up with some kind of vaccine quickly that'll prove effective to some extent, at least in the short term. The big question, I think, is going to be how long the effectiveness lasts.
Can you be infected with SARS-CoV-2 through sweat?
There's no evidence that SARS-CoV-2 can be spread through perspiration. However, places where you might come into contact with someone else's sweat, like gyms, can be risky for other reasons. If someone is doing something strenuous enough to cause them to sweat, then it's likely that they're breathing hard as well, and that, of course, could pose a danger. Interestingly, though, in this vein, there's also research going on into whether canines can be trained to sniff out differences in the sweat of someone who's infected. Dogs are already being used in some settings to detect diseases like early stage Parkinson's and breast cancer, and maybe they can be enlisted in the fight against COVID-19 as well.
Are face shields a good protective option since they can be disinfected throughout the day?
Just like with masks, there's been a lot of debate on the pros and cons of protecting yourself with a plastic face shield, like those often worn by healthcare workers. Some experts believe that when it comes to protection, face shields might actually be a better option than masks, because even though they're open below the chin, they also cover your eyes and they make it pretty much impossible for you to touch your face. Add to that they're more comfortable to wear, and as you noted, they're also much easier to disinfect, and they seem to have some pretty clear advantages. So although the question needs further study, at this point, wearing a face shield seems like an option that can help you to protect yourself and others.